What are the consequences of non-adherence to treatments? If patients do not adhere, they do not get the maximum benefits from the medical treatment. Indeed, non-adherence has a strong impact on the quality of life, health outcome, including premature death and healthcare costs. Most interventions to improve medication and healthy lifestyle adherence seem to fail in their aims. Moreover, most interventions associated with adherence improvements are not associated with improvements in other outcomes, such as biomarkers, morbidity, mortality, quality of care, quality of life, patient satisfaction, and healthcare utilization and costs. Improved adherence may have a strong effect on health outcomes that the development of new drugs. To exemplify, in this study published in 2010 about adherence to antihypertensive medication showed an association between non-adherence to treatment and the decreased quality of life, both in the physical and mental components. Other example, in this large cohort study, non-adherent patients showing worse survival with an increased mortality risk of 38%. In terms of costs, non-adherence to treatment in the United States are valued at $289 billion. This is the reality. Another study, as an example, evaluated the impact of medication adherence on hospitalization risk and healthcare costs. The findings show that the higher the levels of treatment adherence, the greater will be the costs associated with medication, despite lower overall health costs. When we talk about health costs, we must consider, among other factors, the conditions under analysis. In some conditions, such as diabetes, high blood pressure, and high cholesterol, non-adherence increases the likelihood of hospitalization by 77%, 45%, and 35% respectively. Here, we can see a study about association among change in the medical costs, level of comorbidity, and change in adherence behavior for 3 conditions: diabetes, high cholesterol, and hypertension. In general, when a patient transitions from non-adherent to adherent, there is a decrease in the medical costs, and for patients who transition from adherent to non-adherent, medical costs tend to increase greatly. This can be observed for all patients in general. For patients with 3 or more conditions, these outcomes become more evident. So, it is shown that non-adherence to treatments leads to increased health costs. With increased medication adherence, a set of implications for other stakeholders of society arises. In this example, we can see the costs and benefits per stakeholders regarding the patients with asthma. For employers, increased medication adherence leads to increased productivity and reduced early disability benefits. For employees, increased post-tax due to reduced risk of work disability. In the case of pharma companies, led to increased medication sales due to increased medication adherence for asthma. The policymakers have increased tax revenues and reduced later disability benefits due to fewer work disability people. The payers have reduced payout due to slower disease progression and lower recurrence of episodes. Besides that, led to increased payout due to increased medication and short-term service. The health service providers have increased short-term service, for example, physician visits due to increased adherence.
In conclusion, it is important to highlight that technology alone will not solve adherence. We know that technology is only one component to improve medication adherence, but the engagement and communication with patients are essential. Let's keep waiting for more technology disruption.